The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hello folks, I'm Dr. Fazil. You're watching Dr. Fazil TV show for March 2025. The topic today is, interestingly, I will say the most common question I ask when it comes to the heart is the broken heart syndrome is real or not? And I think when people or patient ask, they're attributing it to the heart condition or heart failure. And that's what I'm going to be talking about, heart failure today. Sometime in a funny way, I said, well, if you are asking about a broken heart syndrome, it depends. It could be Romeo broken heart syndrome if the man breaks a woman's heart, or a Juliet broken heart syndrome if a woman breaks a man's heart. So, but on that note, let's change the topic to the real medical discussion, which is heart failure, right? So heart disease is a broad topic. Oh, by the way, I'm Dr. Fazil. I'm an internal medical specialist as well as a kidney specialist. So I see all kind of patients in my practice. Heart condition is one of them. So among the heart condition, heart failure is a most common cause or most common condition, right? So I decided that I should bring up that topic in a more easy to digest fashion, so the patient can understand what does it means, how it presents, and how what they can do at home to keep it under control and to prevent it, right? So that's exactly what we're going to talk today. So folks, the heart failure means, well, first we have to understand the anatomy of the heart. So I'm going to use, as you know, I use the hologram quite a bit, and that helps me a lot to explain my point and my educational stuff a lot more easier. So let's do that. Again, we're going to bring this hologram of the heart first to see how it functions. So here's the hologram of the heart, and we're going to hold it right here. Right here would be the good idea, right? So now you can see there are 4 chambers of the heart: the right upper chamber, right atrium, right lower chamber, right ventricle, left upper chamber, left atrium, left lower chamber, left ventricle, and in between we have the lungs, right? So the bad blood, which can be attributed in the blue color, come from these veins or these blood vessels, and they go from the right side. Now you can see through this arrow, they go to the lung, and from the lung they get cleaned and now red, and then it's go to the left side, and it gets pumped out through this blood vessel known as aorta, right? And you can see that blood is going all the way down and all the way up. As simple maths, simple mechanics of the heart. It has 4 heart valves. You can see on the right side. There's one on the top. Well, there are 2 valves on the right side. The right pulmonary valve, right tricuspid valve, left mitral valve, and left aortic valve, or left aortic valve, right? The valves are supposed to open in one direction only, right? So the blood is flowing in one direction only. But sometimes they start to get leaky, and the blood flow go backward. You can see here. Now let's bring another hologram, and I'm going to actually park this hologram on this side so we can use it for the reference in the future if we need to. So I brought this hologram. Here you can see the valves. They're kind of like leaking a little bit. So when the blood is supposed to go forward, it also goes a little bit backwards. And we call it valvular heart disease. Mild heart valve disease, we see it all the time when we take a picture of the heart through something known as echocardiogram. Echocardiogram is a sonogram or ultrasound of the heart, and that's normal, right? I mean, you get it some wear and tear with time. But if it's moderate or severe, then yes, we will have to do more intervention like valve replacement and stuff like that. But at the mild level, we can just do a follow-up, do medical management, and we can keep it stable. So let's go back to the discussion, right? So the discussion was, or the topic of discussion is heart failure. Well, heart is like a pump, right? So as any pump, is supposed to function 100%. But when we talk about the heart, the function is actually not 100%. The max function of the heart is 45%, maybe 50%. And it's based on calculation, how we do the calculation. But the reason I'm saying that is because when I tell the patient their heart function is 45%, they become really gloomy or sad, saying that why the heart is not working 100%. Well, as I said, the 100% in the heart is 45%. So if you have 45% of heart function, that's actually normal. Actually, if it is more than 45%, it's bad for you. And again, this is based on a little bit complicated calculations, why we say that. But in a layman language, when we say 100%, that means 45%. Just remember that.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
So what happens is when the muscle of the heart becomes weak, or the valves become bad, then the heart would not pump that 45% of the blood is supposed to pump. And what happens is now we can bring this hologram on this side, and let's bring up another hologram, and you can see the heart is this is the heart which is kind of little swollen. It's a little big. The normal heart, as you see from my previous hologram, was kind of normal in size, and this is kind of bigger in size. And you can see the blood vessels which are behind his heart are swollen too, and they're going back to the feet, and the feet are swollen too. So that's why you get swollen feet when you have a heart failure, right? Because the pump is just like any other pump. If you're not pumping forward, your fluids or the heart or the blood is going to be stagnant backwards, and that backward portion would be your feet. So when you're standing on your feet all day long, the feet start to swell, and that will cause swelling in the legs. We call it pedal edema as well, right? So the other condition would be when you lay down. Now you don't have the gravity on your feet, now you have gravity on your lungs. And you can see, so let's have this hologram go away here on this side. Let's bring up another hologram right here. And you see this person is laying down, feet are not swollen, heart is here, lungs are in the middle, and the fluid is getting stagnant inside the lungs. So they become short of breath when they lay down. So that's another classical symptoms of heart failure, like swelling in the legs in the daytime when the swelling is standing up, and swelling in the shortness of breath when they lay down. I mean, they are more short of breath anyway when they walk, but not that much, depending on how bad the heart failure is. So if they were used to walk 10 blocks before they got sick, now they can walk 3 blocks. Well, you know that heart failure is getting worse. And the other, when it's become really bad, when they lay down, they become short of breath, right? So let this hologram go on this side. We'll park it here for now. So folks, basically, as I said, heart is a pump, right? So it has muscles, it has electrical system, which make the muscle contracts. It have valves, so the blood flows in only one direction and one direction only. If anything of that nature is not functioning properly, heart will malfunction. If there's a heart muscle disease, there are different kinds of heart muscle disease. You can have a heart muscle disease from, for example, a viral attack, a medication side effect, right? The muscle become just weak, and poor circulation of the heart by itself. We call it coronary artery disease, that will make the heart weak itself. That's actually the most common cause, right? So the heart is not getting its own circulation, and that's causing the muscle to become more weaker, and that's going to present with a heart failure. If the valve is getting too bad, that will also cause malfunction of the heart and cause heart failure. if the electrical system of the heart is not functioning properly, now bring another hologram, and you can see there's a pacemaker or SA node of the heart is a natural pacemaker, not the one we put it in the patient's heart afterwards. And you can see the electrical current is going from the top and is going on the right side and the left side, right? So as this pacemaker send electrical stimulus, it contracts the left and right ventricle pretty much at the same time. But if that is not working for various reasons, then it can also cause heart failure. So the heart failure we discussed that could be from poor circulation of the internal circulation of the heart. I mean, again, it is so broad topic. I mean, I'm just making it very simple. I mean, there are so many other rare causes which can cause heart failure too. But as I said, I'm going to keep it more easy to understand, and most common causes which are out there, that's what I'm going to discuss. Poor circulation of the heart, electrical malfunction of the heart, muscular dysfunction of the heart, and they have their own reasons for that. Like muscles can be weak due to the virus attacking the muscle of the heart, or tight valves causing too much back pressure on the heart, causing heart muscle to kind of like give up. That can cause a heart failure as well. Okay, so we did discuss that, the most common symptoms, and causes. Let's talk about like what can we do about it, right? So again, diagnose first, treat later, right? So the diagnosis is like, okay, we have a heart failure. Now we need to know why we have a heart failure. So if it is due to the poor circulation of the heart, yeah, you need to do an angiogram, which is actually taking a picture of the blood vessel of the heart. And if there's a blockage, fix it. If you can. If you can't, use medication to make the blood flow more smoother and thinner. If it is electrical malfunction, you might need a pacemaker. If it is muscular dysfunction, then we can use water pills, right? Diuretics, water pills like furosemide, metalazone, spironolactone, or aldactone. There are different kind of medications. So those medications can make the, again, we have to make sure that you drink less fluids and pee more, so your heart have to pump less. That's the way it works, right? So the heart does not like a lot of fluids, so drink less fluids and less salt. Salt also is not good for the heart because it holds the water inside the blood vessels. So if we do those few things, daily weight, if your weight is going up, you're retaining fluids, then you can increase your water pill. Folks, do ask your provider about that before you do all that. This is a general educational seminar or discussion. But rule of the thumb is if you're gaining weight more than a few pounds a day, you should increase your water pills till it goes back to your baseline. So you should know what your baseline weight is, and then if you start to rise, cut down on the fluid intake and salt intake, and also increase your water pills. And that will prevent you from getting into the next very, very bad phase where you end up in the hospital or inpatient treatment might be required, right? Folks, so this is a basic stuff. As I said, the treatment could be more specific, but the general rules of principles of the treatments are, hey, number one, decrease fluid intake, not increase fluid intake. Sometimes people do misunderstand and they start to drink more water, not true. In heart failure, you need to drink less. I say decrease by 30%, less salt, Then also, if you're taking water pill, increase that maybe twice a day for a few days till it gets, your symptoms start to get better and your weights get closer to your baseline weight. By the way, you should know your baseline weight, right? I'll leave this topic up to your providers, what your dry weight or baseline weight is, so you can use that as a reference point. So daily weights would be useful, and that's pretty much it. So now we did discuss about heart failure or maybe broken heart syndrome. So folks, on that note, I will call it an end of this topic for this discussion today. So have a wonderful rest of the month. I will be back next month with more topics for better health, and God bless you and God bless America. I'm Dr. Fazil. Thank you for watching Dr. Fazil TV show.